Lesson 2. What constitutes sex? I am Julina Augustine. So let's define sex. It refers to biological sex or physical sex, which means biological refers to their status as female, male, or intersex depending on their chromosomes, reproductive organs, and other characteristics.
Good day everyone and also Prof. I'm Mary Grace Contreras. Intersex persons is born with a reproductive or sexual anatomy that doesn't seem to fit the typical definitions of female or male. For example, a person might be born appearing be female on the outside but having mostly like typical anatomy on the inside.
I am Jamila Dress. Sexual reproduction starts with the combination of a sperm and an egg in a process called fertilization. This can occur either inside internal fertilization or outside external fertilization, the body of the female. Humans provide an example of the former, whereas seahorse reproduction is an example of the latter.
Good day everyone, my name is Rachel Laika Impictana. Reproductive health refers to overall well-being and functioning of the reproductive system and related processes including access to healthcare service and processes to support reproductive decision making. Ensuring reproductive health is essential for promoting individual autonomy and achieve global health goals.
I am Lovely Espino. Productive responsibilities is an obligation of individuals and societies to make informed and intentional choices about their reproductive behavior. These include using contraception to prevent unintended pregnancies, seeking medical care for fertility issues, and making decisions about parenthood based on personal circumstances and values. Taking reproductive responsibilities is important for promoting individual well-being and ensuring sustainable population growth.
I am Sunshine Gomez. Sexual hygiene. So, there are two main reasons why taking care of your sexual hygiene is vital to your health. First, it reduces the chances of getting infections down there and leading to more significant issues, such as infertility. Second, it diminishes the possibility of contracting all sorts of sexually transmitted diseases.
Good grooming that everyone has a hair and selected parts of our body. It indicates trimming the pubic hair as well as washing the body to avoid unwanted odors. It's basically through taking a bath, shaving your facial hair, taking a haircut, and trimming the pubic hair. We should apply it in ourselves because it helps to prevent the development and spread of infections, illnesses, and bad odors. It makes you more attractive. Always taking care of yourself every day will not only keep you smelling fresh and clean, but also improve your self-discipline and more importantly, form good habits.
This infection is most often caused by microbes such as fungi, bacteria, and virus and involves the kidney, ureters, ureta, or bladder. For practice good hygiene, keeping your genitals clean and dry, urinate regularly, always empty your bladder completely when urinating, empty your bladder after sexual intercourse to wash away any bacteria that may have gotten into the ureta. Stay hydrated by drinking plenty of fluids.
Dental hygiene is important to your oral health and physical reproductive health because it reduces your risk of developing tooth decay and gum disease. It helps avoid the transfer of sexually transmitted infections if the mouth is used for sexual intercourse arousal. When left untreated, both tooth decay and gum disease can have serious implications on your oral health and physical reproductive health.
Washing the genitals is also important part of person hygiene and involves cleaning the external genital with warm water and mild soap to prevent infection and maintain good health.
Washing of sex toys and other devices used for sexual stimulation. You should clean your sex toys device every time you use them. You definitely need to wash it well after early use, and you might rinse it off before using it again in case it's dusty. By cleaning your sex toys thoroughly after each use, you should not have to worry about giving or getting an infection or UTI.
So why is it important to get physical checkups? Because getting physical checkups benefits a lot, including first one is early access to treatment and care. Second, ability to make family planning choices. Third one is possibility to make lifestyle changes. And the last one is ability to change behavior to avoid transmission to partners.
Taking medication may cause sexual dysfunction as well as if non-prescription will hamper the sexual arousal. Many medical conditions and their treatments contribute to sexual dysfunction. You should talk to your healthcare provider if you think that a drug is having a negative effect on your sexual performance, because some of the medicines may lead to life-threatening reactions if you do not take care when stopping or changing them. It can can affect your sex life, and the symptoms may vary depending on what type of sexual dysfunction you're experiencing. It might be low sexual desire, sexual arousal disorder, orgasmic disorder, and sexual pain disorder.
Hormonal imbalances. Hormones are powerful signals. For many hormones, having even slightly too much or too little of them can cause major changes to your body and lead to certain conditions that require treatment. For example, obesity. Many hormones can affect how your body signals that you need food and how your body uses energy. So, an imbalance of certain hormones can result in weight gain in the form of fat storage. Another example, excess cortisol, a hormone, and low thyroid hormones. Hypothyroidism can contribute to obesity.
Unhealthy lifestyle. In fact, a new study reveals that several unhealthy lifestyle factors such as weight problems, physical inactivity, high alcohol consumption, tobacco smoking, and hard drugs are associated with sexual dysfunctions in men.
Sexual dysfunction refers to difficulty experienced by an individual or a couple during any stages of sexual activity, which may prevent them from experiencing satisfaction or pleasure. This can include problems with desire, arousal, orgasms, or pain, and can be caused by a range of physical, psychological, or relation function.
When we say psychological problem or condition that affect your moods, behaviors, or thoughts. So if you think that you might have a psychological problem, you are not alone. Many people with psychological conditions can recover, especially if they begin treatment early and play an active role in their recovery.
So, sex negativity refers to a mindset that sex is inherently dirty, dangerous, risky, pathological, or deviant. Certain kinds of sex are seen as normal and thus acceptable within the bounds of heterosexual procreative monogamy. Meanwhile, those types of sexual identities, expression, and acts that fall outside the bounds are considered deviant.
Stigma on consulting with the sexologist. Sexology means interdisciplinary scientific study of human sexuality, and those who study the subject to become a specialist are known as a sexologist. They are the experts who study the science of sex. Most especially, men and women suffer from sexual disorders. Some may also ask how a sexologist may assist them in their sexual experience with their spouse. So sexologists can deal with issues. For example, the sexologist will discuss something in that particular issues, and then right after, they will provide the specific considerations that you have keep in mind for better sexual health. They will guide you towards effective treatment.
Sexual awareness is about acknowledging just how big your sexuality is, including its innate connection to your reproductive and overall health. For example, desires disorder, lack of sexual desire of interest in sex, arousal disorder, inability to become physically aroused or excited during sexual activity, organisms disorders, delay or absence of organs.
Sexual trauma is the exposure to any sexually abusive behaviors. Sexual abuse is any inappropriate, intentional behavior that is intended to give the offender some form of sexual gratification. The behavior could be physical, such as being touched or grabbed in a sexual manner, verbal, such as humiliation or threats of sexual acts, or it could be visual, such as being forced to view sexual image or acts.
Sexual stigmas. Privileged individuals or the majority group members are the main contributors of placing sexual stigmas on individuals and their minority group.
Examples of sexual reproductive responsibilities is sexual coercion. Sexual coercion happens when there is unwanted sexual activity or no sexual consent between two persons. So for example, if someone has pressured you into sexual activity or has made you feel like you owe them a sexual favor, that is considered sexual coercion.
Lack of intimacy. So, lack of sexual intimacy can create emotional distance with potentially devastating effects. Although a spouse is lived in the same room, they may begin to feel as if they are merely roommates. Sexual intimacy established and secures both physical and emotional closeness.
Lack of sexual consent. Consent is demonstrated verbally or through actions that clearly indicate a willingness to engage in a specific sexual activity. Lack of verbal or physical resistance does not constitute consent. Consent happens when all people involved in any kind of sexual activity agree to take part by choice. For example, agreeing to kiss someone doesn't give that person permission to remove your clothes. It's important to discuss boundaries and expectations with your partner prior to engaging in any sexual behavior.
How does sexual desire discrepancy affect relationship? Most people who've been in a long-term relationship are familiar with the concept of desire discrepancy, which is when two partners aren't aligned about when and how often to have sex.
Safe sex is important because before you do it, you must have open communication with your partner about sex and respect whatever his or her decision may be. Safe sex prevents HIV being passed on through sexual intercourse. Safe sex also protects you against unintended pregnancy and against some common STIs that can be transmitted during intercourse. For example, chlamydia and gonorrhea. Use condoms for safer sex. Condoms provide the best protection against STIs.
Safer sex. Taking extra precaution to protect yourself and your partner from STIs, HIV, and unplanned pregnancy. Having the ability to communicate with your partner, which involves receiving consent every time you engage in sexual activity with your partner.